Signs, signs and symptoms of osteoarthritis. This is where the joints in the hands, hips, knees and spine are affected, the cartilage wears out and bone rubs on bone. It causes patients a lot of pain, and physical examination and history is the best way to diagnose this condition. Signs and symptoms of rheumatoid arthritis. This is where the connective tissues in the joints, mainly around the hands, fingers, wrists, elbows, knees, the connective tissue gets replaced with fibrous tissue, making the joints deformed, and the patient is in a lot of pain again and loses function in the joints that are affected. Signs and symptoms and presentation of eczema. That is inflammation on the skin. A lot of people that suffer with asthma often get eczema due to allergies in the elbows, under the arms, behind the knees. It's common signs of where eczema can be. It's not contagious, but if you can identify the irritant, that's helpful with controlling the problem. Signs and symptoms and presentation of psoriasis. There's a skin condition with the epidermal cells. They grow too fast, which creates red raised lesions on the knees, on the elbows, and through this hair on the scalp. It becomes flaky and itchy and sort of peels off. I guess it's almost like a second layer of skin. Signs and symptoms of acne. This is a condition that's like blocked hair follicles, blocked with oil, dirt, makeup. This produces pimples, which can be either an open pimple like a blackhead or a closed pimple, which is a whitehead. Pores become blocked. Daily cleansing of the face can help this problem. There are other pimple treatments that can be used. Signs and symptoms of rosacea, which is the redness, like blushing on the forehead, the nose, the cheeks. Mainly people with fair skin suffer from this. Also, it may give the patient low self-esteem as they're embarrassed by their condition. They become shy. There's no known cure for this problem. Okay, lung sounds. With your lung sounds, you've got wheezing and you've got crackling. Crackles sound like popping in the airways. On breathing in, which means there could be some sort of respiratory distress, perhaps an upper respiratory problem, lung disease, asthma. Wheezing is another breath sound. Again, that's more related with asthma, breathing in, breathing out, with some sort of irritation to the airways and perhaps a blockage, something causing that wheezing. Okay, signs and symptoms of hepatitis. The main sign with hepatitis would be jaundice, which would be the yellowing of the skin and the whites of the eyes. Patient will feel generally unwell, muscle pain. Other symptoms of hepatitis could be dark coloured urine, light coloured stools. There are a few different sorts of hepatitis. Blood tests will determine which one the patient is suffering from. Signs and symptoms of fatty liver. Not a lot of signs and symptoms of fatty liver. Mainly doctors diagnose this when they're doing a palpation of the abdomen or blood tests for some other reason, and the fatty liver then is diagnosed through this. Biopsy of the liver is one test that can definitely confirm, but other tests seem to sort of point to the direction that there would be a problem with the liver. Signs and symptoms of cirrhosis of the liver. This condition is irreversible, where the cells of the liver are replaced with scar tissue, making the liver become unfunctional. Main reason why this happens is major alcoholism. Otherwise, hepatitis or fatty liver can also cause the cirrhosis of the liver. Irreversible, can only treat the symptoms, cannot treat the liver to repair itself. Thank you.